Good day to all of our English-speaking part of our community. I'm back again with an update. As you might have heard already, we have scaled up the measures that we take related to the challenges we face with COVID-19. What I wanted to do today is give you a little bit of a background why we needed to take what's really going on, why we took these measures, and also tell you something about what the current state of affairs is. So I have a couple of slides I wanted to share with you. Can I have the first one, please? On this slide, what we depict here are there are two axes on what we call the y-axis. On the left, you'll see the numbers 2, 4, 6, 8, and 10, and on the right-hand side, they are higher, 10 times as much: 0, 20, 40, 60, 80, etc. What these depict, the blue bars or the blue columns, they depict the daily cases. And as you know, in the beginning, since the beginning of March, we managed together by taking measures to keep the daily cases fairly low. Where you see the arrow in the graph is the 20th of August. That's the date where we announced that there was local transmission without being to detect the source of this transmission. And that poses a problem. Why? Because if we don't have the source, remember the pillars of successful containment are detection, isolation, and contact tracing. So if you detect and your contact, it isn't clear what the source was, that means that there could be one or more sources that have already spread the disease or the infection on our island. And so you need to take into account that in the coming days or weeks, you will see further increase of transmission. And that's exactly what we saw. The orange graph on this depiction is the cumulative amount of cases, and that's why you see it going up. But you see after the 20th that the incline becomes steeper, and the number of cases per day starts to increase, and it increases significantly, so that the increase of total amount of cases are now far beyond what we had for a very long time on the island. Remember, this graph only runs from the 11th of March till the 11th of September. So that is already a couple of days ago. In reality, we are now at a higher amount. We're not at 145, we're at 192 cases. But I'll get back to that in a little while. Can I have the next graph, please? So we see the amount of cases are increasing. And I just told you, it also means if we see more cases increasing, that also means that we have to detect, isolate, and further do contact tracing and test more people to find them as rapid as possible, so we can isolate them in their turn and do contact tracing with them again, etc. So how is that? Have we done more testing? What you see here is all of the tests that we've done on the island from March. You see a couple of peaks there on the during the middle of this graph, or 3/4. Those are individual peaks because it was repatriation flights coming back with large groups of people in quarantine that all tested towards the end of the quarantine. That's why you see one-off type of big peaks coming out on the bars. And there was also one big crew change of, I think, about 160 or 180 people that we had to all test on one day. That's why you see very sporadically, you see some higher numbers per day being tested in the period before the 20th of August. But as of 20th of August, as you can see on the graph, you have quite some more amounts that are in the high range of testing, and they are in very rapid consequence of each other. So it's on a daily basis that we are actually testing more people. Let's look at that a little bit more closely. So if I can get the next graph, then I can show you what I mean. So here's the same idea, only a little bit more spread out. You see these one-off types of peaks that I just described. You see the green graph, that's the cumulative amount of cases that we're looking at, and on the left it's the total amount of tests. So as I just told you, at the end of the graph you see what's going on now. So we are testing more and we are finding more. We are finding more because there are also more out there, but also because we're also testing very target-wise, is looking for people, trying to find them as early as possible to be able to isolate them, so that in a relatively short while we can get those cases, daily numbers of cases, back to where we want them, which is as low as possible. So the arrows you see are the first arrow is the 20th of August, when we announced local transmission without a detectable source. And just a couple of days later, we introduced our drive-through testing facility to be able to handle greater amounts of people testing on one day. And that's where you also see the curve and amount of people being tested. That's the green curve. The incline becomes a lot steeper, and that shows that we actually are testing a lot more people on a daily basis. If I go to the next graph, please. This depicts that as well. You see two bars. One is all of the tests we did from the beginning of March on to the 20th of August, and we did a total of 2,148 people were tested. And that's excluding the people we tested from the ships, by the way. And after the 20th of August, we tested about 3/4 the amount that we tested in all of the months, previous months. So in 3 to 4 weeks, we tested 3/4 of the amount we have done 5 or 6 months over to test. So that also indicates to you that the amount of testing that's been done in the past 3 or 4 weeks is significantly higher than it was hitherto. Next slide, please. So the question is, well, how much capacity do we think we have with testing? What you look at here, the horizontal gray line is the average tests that we're doing per day now. That's around 80. But in reality, we've gone up. We can move it upwards to 140, maybe even more. We think we can get more out of it. 120 is around here, 115. We think we can do higher than that. We've shown that also. The orange and yellow lines that you see are an indicator of how many tests we will be able to have done if we continue this trend, or even higher up our test capacity by the end of October. Then we should be at a rate of at least 7,000 people that we tested if we keep this up, and if that's necessary to keep this up. To be able to get that, we're also preparing another drive-through facility to be able to handle even more cases. So what I try to show you now is, yes, your total amount of cases have gone up after notifying you of local transmission without being able to detect the source. We have tested more, significant amounts of cases more, and we have also increased our testing capacity. But may I have the next slide? Because there's something else I'd like to show you. We also look at the positivity rate. So, okay, we're testing more, but how do we know if we're testing enough? So in the entire period before the 20th of August, and you see that when you look at the graphs, you see one spiky one, that's the blue one. I'll disregard that for now. Let's just focus on the orange line. The orange line is a moving average, 7-day average of your positivity rate. And you see that you're supposed to be, this is from August 20th. Before August 20th, so when we announced the case, we had a positivity rate of 1.72. That's very low. Ideally, you have to be under the 5%, which we were. So all of that time before that, we were doing good because we, in reality, didn't have too many cases. We were testing sufficiently. We achieved a positivity rate of 1.72 because that adequately reflects the attack rate that there is in the population. Because in reality, there are probably less than 1% of the people that actually get infected to begin with. So if your positivity rate is too high, That means that there are too many people that go undetected yet because you're not testing enough and you're not finding enough people to actually depict reality as what is going on in your island at that point in time. And you can see that after the 20th, that although we increased testing, after the 20th, if we take the whole period, then the positivity rate is 6.66, which is slightly higher than 5%. And you can expect that if you have an outbreak. Then, of course, you're going to be targeting more, you're going to find more, which is in itself not a bad thing, because you want to find more to be able to find people as quickly as possible so you can isolate that, with the intention that after a couple of weeks, that will lead to dropping your daily amounts of new detected cases. But if we also look at per week after that, because we see that the cases were intensifying per week, that after the 1st of September, we already had in that first week, it was 8.63. And in the week from the 3rd of September to the 9th of September, the positivity rate in that week was above the 11%. And that's too high. That means that even though we are testing a lot more, we are still achieving a positivity rate that's high, which indicates that there may be more people out there that we're not detecting. That's one. But it's also an effect of doing very secure contact tracing and very targetedly also testing people that we are also actually finding more cases when we're trying to isolate those and those who are in close contacts, looking for them as immediate as possible and finding them. That also shoves your positivity rate up. And the intention is, if that's only the case, then we should see a drop within a couple of weeks also. But if this represents widespread transmission, then we might be in a bigger trouble than we think or than it looks like. And that's why you would need to take measures. So let me show you the next graph, because that's also important for this. This shows you the amount of clusters. In the meantime, those too have increased. On the left side, you see a cluster is defined as 3 linked cases, at least 3 or more cases that are linked to each other. On the left-hand side, there's a cluster of 3 persons. This cluster is inactive. Inactive, why? Because they've all recovered from the disease and there are no other cases that are linked to this particular cluster. The rest are still active. So we still find cases that are still pertaining or linked up to persons within these groups. And if I get the next slide, you can see that there are more clusters. So there are not only 5. There are actually 14 clusters, of which 1 is inactive. So you see the amount of clusters have increased. And I don't know if you remember, but when we presented the strategy of how do we scale up and take extra measures, that also the amount of clusters is an indicator that we look at, that if they get higher than 10, for example, that would be the point in time where you have to take a measure. Because if you don't, again, we're not afraid of the disease. 80 to 90% of the people don't have severe disease, but 10 to 20% do have it. And if 10 to 20%, if there's a big group of people that are affected by the virus at the same time, then the amount of people being admitted in the hospital and in the intensive care unit, they will surpass our capacity, and then we'll be in trouble also for diseases that are not COVID related, because we can't handle them anymore. So there is your necessity for taking measures to prevent us from getting into that human disaster. What's important to talk to you about is not the clusters in itself, but also on the left-hand side, on the lower left-hand side, you see groups of 2. These are by definition not a cluster because they're 2 and not 3 as yet, but they could become clusters. So they're not clusters yet, but they could quickly become a cluster. So we need to keep that in mind and look at it. But what's even more important is that somewhat larger group on your right under part of the graph. And those are all people that are up until now solitary cases without us being able to detect a source or a contact within these cases, which means that there are more around there that are being infected without us being able to detect the source. And that means that the transmission is wider spread and could spread wider. And that, ladies and gentlemen, all together form the reason of scaling up and moving towards phase 3. What does that mean then in effect? That there are measures that were in place, of course, stay in place, but they will be upgraded. So there will be a curfew from 11 to 5 that I think by tomorrow it should be being implemented. Also, measures that were there ready, sharpening the measures of supermarkets and what have you not. Sports events can still take place, but without any public. And it's we're encouraging also lower groups of people to be, for example, in churches or religious gatherings, and they cannot be more than 50. If they want more than 50, then they should ask for a permit, especially no singing in churches or no singing and big singing event as such, because with singing, if it happens to be a super spreader, you can affect a bigger group of people altogether. I will get back to that shortly. So these are the type of measures that are taking. Also, that there is a prohibition on forming larger groups than 4 together on the street. So these are the type of stuff that we need to do to try to make sure that we don't have to get into a lockdown, because the measures you take, you try to find a balance between allowing life as we know it, livable life, as normal as possible to continue, but we must take heed that we don't allow the transmission to surpass our care capacities. There's one more slide I need to show you in this respect. I talked about the clusters, but there's something that we call the syndromic surveillance. And the syndromic surveillance, so if I can get that slide up, we have 10% of our local GPs. They are tallying for us all syndromes that are correlated to infectious disease, so communicable diseases, on a weekly basis. They've been doing that for 13 to 14 years by now. So what you see here is a graph that depicts the patterns of of respiratory symptoms on our island for the past 13 to 14 years. Those are the red and the green graphs. Those are the high-end averages per week. So the x-axis shows you the week numbers, so week 1 or 4, 7, 10, etc. We are now in week number 38, so the reports on week 37 still have to be analyzed. So the green bars that you see are the cases per week, and they are set off against the averages for those weeks during the past 7 years. While the red graph is a higher end average and the green graph is a lower end average. What does this mean? Ideally, you want to stay below the green line. If you're between green and red, you should already be looking out where is this going to. If you have 2 or more consecutive weeks above what you can expect maximally in that week and that day or that week of the year, so that season of the year, if that's more than what you normally can expect, we traditionally call that an epidemic. And if you look well around a little bit further than the center of the graph, you will see that for weeks 35 and 36, 2 weeks in a row, a higher number than usual was reported on respiratory symptoms and fever on our island. And because it's too early for the flu season, which is traditionally at the beginning and the end of the year, you can see the red and green graphs going upwards in those periods. We aren't there yet. We're not in that period where we traditionally see flu. So we think that there is a big chance that what we're looking at now actually represents COVID-19, which also indicates that there is wider spread transmission in our island than you could fathom by only looking at the numbers. So all of this puts together the rationale why measures need to be taken now, because you have to take into account, if you don't do anything now, then the situation that there are more people walking around that are possibly infected, that can transmit the disease to others, that will increase in 2 weeks' time. We probably can handle that increase yet, but if we don't do something now, then that increase will lead to a further exponential growth in 4 weeks' time, and that would be surpassing our capacity or coming very close near it, and therefore we need to take measures right now. So, where are we now? Because I told you the graphs that I showed you went up till the 11th of September, but yesterday we reported 23 new cases from about 150 test results that came in. 23 new cases for a day represents a new high, a daily high of reporting. We never had this amount of new cases reported within 1 day. And the reason for having that many is that about a week ago, there was an event with music, with one super spreader, so somebody who had a very high viral load in the back of its throat. If there's a music event, he spreads it easily, he has to talk louder, shout louder, maybe even sing. And so many people within that group got infected. After we found out that there is one person infected, we did a contact tracing, and we found a whole bunch of people that are interlinked with each other because they come from the same group together a week ago. This is exactly the reason, and people might be angry about that, for us saying why you have to avoid these super spread events, why you have to try to limit the possibility of that becoming so, why you're limiting the possibility of singing in church. A lot of people are angry about that. But that's not to hurt you or to try to limit your spiritual experience or whatever, but because we need to balance, as I just said, and try to keep the population as safe as possible. You don't know who's in your church. People might be there who are super spreaders, who are ill, even though they don't feel ill, even though they haven't reported, even though they don't think there's very much going on, and they sing together with everybody else. You're in a closed, confined area, maybe not all that hot kind of ventilation, and that's where you can cause for many people at the same time to become infected. And the problem with that is that amongst them, they too might be people who don't know about it yet, or start becoming infectious to others 3 days before they have symptoms, and then you have a whole spread event going on and more difficult to contain. You see that happening in different countries in Europe, in the United States for sure it happened, and you see that happening in our neighbor island in Aruba as well. So therefore, again, this is the rationale why we need to take those measures and take measures in order to try to contain. So where are we now? If I can have the graph with the numbers of the day. So all in all, we have 192 positively tested patients. These are cases, or these are people from on March. That's not the amount of people that we have now. The amount of people who are active now, our active cases, are 123. This is because we, aside from reporting 23 new cases yesterday, we also reported 7 people who recovered. All in all, 68 people recovered. 1 had passed away way back in March. Of the 123 active cases, 2 are admitted to the hospital at this point in time. All right, I talked a lot probably. I hope to have given you some better insight and understanding in why we needed to scale up and what the current state of affairs is on our island. Why it is necessary for us all to take our responsibility, try to avoid events where there's a big group of people together. Usually that's in the evenings, that's when we have our social happenings, that's when we go to the bars and the snacks, that's when we have loud music, that's where we have parties. That's why the measures have been taken to reduce this or to limit this or to also prohibit these types of events. And that's not because we don't want you to have a good time. We actually do, but at this point in time, we need to take these measures to keep our population safe. So let's try to do that together. Take your responsibility, avoid large crowds, keep your distance. If you cannot do that and you're in closed, confined areas, you might want to use a mask. Other than that, stick to the social distance ruling, because that's really the most important thing that you can do, and stick to the cough and sneeze hygiene. Remember to cover your cough, cover your sneeze, sneeze or cough within your elbow, and remember to wash your hands regularly. That wouldn't be a bad idea either, although that's more for yourself. The most principal way and route of you transmitting the virus is through airborne, is through your respiratory system, is through coughing, sneezing, talking from somebody that's infected, doing that to somebody else who's not keeping enough distance and within range of him able to breathe in the droplets that have been transmitted. So thanks very much for listening. I hope to have informed you. Please keep safe and help us keep the island safe as well. Thanks very much.